Welcome back to the show. And as we told you earlier, we are going to be talking about this situation that we have unfolding in our country, where we're going towards this endemic phase. So the big question then becomes, are we ready? The two countries that I call into question would be, of course, Singapore and the UK. In Singapore, they opened up and then they had this surge, which was unexpected. In the UK, they had a surge, but they don't seem to care. So it's just like, okay, whatever. We're still going to watch our EPL. We're still going to enjoy our theatre. We're going to go out and have ourselves our lives back.
Yeah.
So that's what the UK kind of is doing, despite record high cases. But the good news is that despite high cases, ICU admissions and the death rate has remained steadily low. So that's good. I guess that's endemic.
Yeah, I mean, that sounds good, but obviously, when we're talking about moving on to the endemic phase, I'm always talking about the vaccination rates. So my question is that enough?
Right.
But obviously, we'll be talking about it more because we have an expert in the room with us, and this is Dr. Diana Zainuddin, who is the consultant respiratory physician from Pantai Hospital Kuala Lumpur. Consultant respiratory physician, or in simpler term, a lung doctor. Am I right, doctor?
Yes, that's very right.
Thank you. Okay. Thank you for joining us.
Thank you.
So, first and foremost, the two big terms, pandemic and endemic. We have diseases that are already endemic that we're living with, dengue, malaria to a certain extent, and things of that nature. But with COVID, it seems like it's a different virus, and the way we're defining endemic seems to change to suit the virus. Your thoughts on that? What's the difference between a pandemic and what now we're using to define endemic?
Okay, so if we look at pandemic, it actually refers to worldwide or global spread of a new disease. So in terms of COVID-19, in March 11, 2020, the WHO has declared COVID-19 as a pandemic disease due to the severity and also the global spread of the disease at that time. And going back to the example that you gave, rightly so, about endemic refers to things like something that we constantly see in that particular geographical area. And for Malaysia, for example, we see dengue cases and malaria happening from time to time, you know, in a constant rate throughout the year, in that kind of like a smaller kind of like geographical area, if you like, yeah? So that's the main difference. One is more of a global thing, something that new that has arrived, whereas endemic is something that is constantly present from time to time. So
Right.
yeah.
So it's like a new person that you meet, and then this is like an unwanted stranger.
That would be a good example actually. So yeah, COVID pandemic is something that is completely strange to us,
Right.
but sooner or later it might be something that you will see regularly in your life, you know, on a daily basis, if you like, or from time to time. Yeah.
So what needs to happen for us to familiarize ourselves with this stranger, doctor? I mean, what are the criteria needed for COVID-19 to be classified as an endemic instead of pandemic?
All right, okay. So the expectation that this COVID disease will be an endemic does not actually mean that the pandemic will simply go away,
Right.
you know. The virus will still be with us, you know, it will continue to circulate around, but perhaps, you know, we will start seeing that the number of cases are going to get less and less, and the transmission rates are also going to be less. So we're going to see like constant spikes of cases occurring from time to time, but they won't be like, you know, it's possible to still have an outbreak, but then it will probably be a more constant thing. So you're going to have to try and start seeing that, you know, living with the virus, you know. And if you if I could perhaps say, respiratory virus is something that is not easy for us to eradicate. They won't easily go away. So they continue to evolve, you know, and the way they impact or affect people continue to going to change from time to time. So if we know the previous viruses, coronaviruses that are also cousins of COVID-19, like H1N1 and MERS-CoV, they used to be pandemic in the past, but they are now endemic. So as we entering endemic, we will start seeing that more and more people are getting more immune to the disease, and therefore the number of cases will tend to go down. So we're seeing less and less people getting the disease,
So that kind of explains what happened in Singapore, where they were locked down for a very long period of time, and their strategy, the initial strategy of zero COVID, worked to a large extent. They had very low societal transmission, and then once they opened up, they were a very COVID naive society, and all of a sudden, despite high vaccination rates, you could see people still getting infected. But here in Malaysia, I think it's a bit different. We have had our record number of cases, and it's good to see the numbers come down. But nevertheless, the big question then becomes, there are people who are still kind of resisting the vaccine. And I want to send a message out to them that less than 10% of the adult population has yet to be vaccinated for one reason or the other. But if that reason simply is, I don't want to get vaccinated, what can you say to them?
Well, I think as the endemic phase is going to, be with us pretty soon, I think we need to start, thinking of getting immunized, because by getting immunized ourselves, we can somehow help to protect other people, especially those who are not eligible, if you like, to have the vaccine for health reasons, for example, or some sorts of like other types of things that will prevent them from having the vaccine, like side effects, and all that. So for us to be prepared to that, we need to make sure that we have some sort of like immunity, towards fighting the virus. Either we survive by having a natural infection, or we survive by having a vaccination.
And I don't like the term breakthrough infection, because it does send a message that the vaccines don't work. But the truth of the matter is that infection is not necessarily something that generates terrible symptoms. It's a very mild sort of reaction. And you test positive simply because the test is conducted in your mucous membrane. So I do feel we need to push back on that breakthrough infection that's kind of scaring people away from taking the vaccine, because they see that, hey, if you get a vaccine, you can still test positive. So why do I need the vaccine? Can you help us understand what our lives would be like in the endemic world?
So I think at the moment, it will be still difficult to actually say this, because we are still very early, and obviously that there will be a lot of uncertainties, that remain out there. But you were right when you said that when you get a vaccine, are you still going to get infected? The answer is yes. No vaccine gives you 100% protection. You still can have the disease or the virus itself. But what we are seeing now is that number of cases are generally quite mild, okay? They don't tend to need oxygen, or if we put them on oxygen, we tend to be able to wean them off very, very soon, compared to previously. They tend to drag over and over again, for such a longer period of time. So if we were to divide this into the short term, okay, and the long term, effect or approach, if you like. So for the next few weeks, when we enter endemic, perhaps things are pretty much going to be the same. The masking in public places, social distancing and all that will probably remain the same. But perhaps in the future or in the longer term, we might be seeing that things like working from home will be something that is more common to be done, especially if you're down with sniffles. You are allowed to go to work, but you're working from home. And then kids, for example, at school, if they are down with sniffles, they're not allowed to attend school, but they perhaps can do online classes at home. And then rather than wearing your mask all the time, when the cases are generally mild, and even though they are, constantly present, we probably only have to mask up when we are not well, rather than, all the time, things like that. Yeah.
We're looking forward to that, because we've been masked on and hosting for the longest time.
Yeah, it's not nice.
I think people have forgotten our faces.
Probably, yeah. Please go to our social media. Remember how our faces look like. Doctor, I just want to check, in the endemic phase, right? Because there is a percentage that has not been vaccinated yet.
Yes.
And I understand that how the virus works is that they circulate amongst people who have been unvaccinated, and then they mutate into something else, a new variant. Can we expect a new variant in our endemic phase? Is that possible?
Yes, of course, it is very possible, because entering endemic does not mean that you can't go back into a pandemic, So that's why I say we cannot be complacent. We cannot let our guards down. So once we have been vaccinated, we continue seeing that cases are mild, okay, but they are still there. But then there will be, time when there might be spikes or outbreaks of new variants coming, and these new variants are probably something that our body is not used to, so we may react, to it in a more kind of like bizarre manner. So we may have a little bit of more dramatic immune response towards this new mutation, if you like, of viruses. So it is possible, because that's what we've been seeing so far. You see, for example, with the Delta variant, if I remember from the start, when I started treating COVID patients, the cases were generally quite mild, even though there were a large number of patients or people getting infected, but they were generally quite mild, and the mortality rates at that time was lower. But then as we vaccinate more, and then as we are starting to see like people traveling in and out of the country, and of course, these viruses, we may bring it from outside, but the virus in itself, we don't know how they work, but in order for them to be able to survive longer in human population, they need to be able to have some sort of mechanism where they can survive. They also need to be able to build their own protective mechanism to survive. So they mutate, so in order that they are constantly present, from time to time in the human population.
So they have their version of a vaccine.
Somehow, yes, if you like.
That's horrible. Well, anyway, when we look at how should we prepare for this endemic phase, are we ready? Do we have the preparations that we need in place? I mean, people are still walking around masked up most of the time, but in certain resort islands, I won't mention which one, people are having a good time. It's like COVID never happened, and we can see that people are more relaxed, and it seems that COVID has not, gone on a trip yet. But this is not so, because it's a respiratory virus. Wherever there are people, there are bound to be chances of infection. So how can we address this and tell people that you need to still, have those SOPs in place, but we have kind of opened up, so you can travel, but you still have to be on guard.
Okay, so again, as I said before, in order, so now we have to start living with the virus, okay? We've got no choice, we know that lockdowns didn't work for us, okay? The numbers continue to rise, and we have vaccinated almost, 90% or more of our population, but we are still seeing cases, so we've got no choice but to live with the virus. For what I can say is that for those who have not yet vaccinated, we need to start getting the vaccine. But at the same time, whatever that we are doing now, we need to re-emphasize on risk assessment. Indoor places, for example, places with poor ventilation. Those are the areas that we need to focus a little bit more in order to make sure these places are ready and prepped up, to face the endemic. So social distancing in, indoor places still have to be emphasized. But then perhaps, when we move outdoor, when ventilation is better, then we should try and see how we can allow people to take out the mask and all, because we know that areas with better ventilation would provide, less chances to transmit the virus among all the other people. But of course, at the same time, we need to continue to educate the public, on other myriads of non-pharmacological, non-medical steps. Like if they are not well, they shouldn't be in a public place, okay, because this is to allow other people to have fun, but at the same time, we do not want to compromise on what we have, because there are people out there who are so vulnerable, if they were to get the infection, they may not be able to survive, or they may react to the infection in a very bizarre manner. So, multiple organ failures, prolonged hospitalizations, and all that. So, if we were to have fun, maybe we have fun, but then for those who are unwell, better that they stay at home rather than going out, things like that.
It's frustrating because we just got used to the new norm, but now there is a new norm you have to get used to. But I guess that's the way it is. But I mean, for you, doctor, because you are one of the frontliners, and I think the experience must be harrowing during the pandemic phase. I'm sure that doctors such as you are very welcoming of the endemic phase. Am I right?
Yes, we look forward to it. If we were to tell you the truth, we are also very tired, you know. Yeah, having to face, you know, and see our patients are all getting sicker and sicker, you know. So we want to try and see where things can be a little bit more normalized, you know, so that everybody can have a little bit of a chill time, you know, if you like, yeah, and people get better sooner rather than later from being infected with this virus, yeah.
Thank you, Doctor, for taking time off your Sunday to be here with us on
Sure.
Fresh Brew. It's really very special to talk to you about the endemic phase because we're already in that phase, and we look forward to more restrictions being lifted in the near future.
Yeah, it was a good reminder as well. So we appreciate you coming in here. Thank you so much.
Thank